Joyce, take two.
All right. Good morning. This is Richard Joyce, Board President of the Oregon Board of Pharmacy. I will now call this meeting of the Oregon Board of Pharmacy to order. Today is Thursday, August 7th, and it is 8:35 a.m. Board of Pharmacy meetings are conducted in accordance with the Oregon Public Meetings Law under the Public Meetings Law governing body. Meetings are open to the public except as otherwise provided by law. The presiding officer has the authority to keep order and to impose any reasonable restrictions necessary for the efficient and orderly conduct of the meeting. Governing bodies are authorized by ORS 192660 to meet in executive session in certain limited situations, including the consideration of information obtained by the Health Regulatory Board as part of investigation or of licensee or applicant conduct. All official actions by the board must be taken by public vote, and the vote of each member must be recorded. Our mission: Oregon Board of Pharmacy serves to promote and protect public health, safety, and welfare by ensuring high standards in the practice of pharmacy and through effective regulation of the manufacture and distribution of drugs. Oregon Board of Pharmacy is committed to diversity, equity, inclusion, and belonging within its organization for the public it serves. Commitment is reflected in board membership, agency staffing, services provided, and its efforts to promote patient safety and ensure access to quality pharmacy care. The board encourages review of its full 2024-2026 DEIB plan located on the board website. I will now call roll for board and staff. For the record, when I call your name, please verbally acknowledge here. Board President Joyce here. Board Vice President Amy Kirkbride.
Here.
Board Member Kat Shin.
Here.
Board Member Jennifer Hall.
Here.
Board Member Victoria Kroger.
Here.
Member Priyal Patel. Here. Board Member Anna Pinell.
Here.
Board Member Brian Smith. Here. Chief Compliance Officer Joe Ball. Here. Compliance Director Brianne Effermoff.
She's here.
Is here. Okay. Okay. Licensing Director Christy Hennigan.
Here.
Operations Manager Rachel Melvin.
Here.
Executive Director Gary Runyon. Here. And Board Counsel Angela Hunt.
Here.
Public comment will occur towards the end of the meeting today. The board will not deliberate any issues or requests during public comment, such as formal requests, issues currently under investigation, requests pending before the board, or currently proposed rules. Public comment is limited to matters that were noticed on the board meeting agenda, and comments will not be allowed that are longer than the time allotted by the chair. To sign up for public comment, email your request to pharmacy.board@bop.oregon.gov by noon today. Reviewing housekeeping items and meeting etiquette. Board and staff, identify yourself as board staff last name, board staff member last name. Each time you speak, one at a time and directly into the microphone. Raise your hand when you have questions, comments, and silence all devices. Please note that this meeting is being recorded and retained for public record purposes. Board will break for lunch at 12 to 1. We'll begin with review and discussion of the rulemaking hearing report mailing A with staff member Melvin.
Thank you. Give me just a moment, please. I'll share my screen. All right. Again, this is mailing A. This is our rulemaking hearing report. So today we're asking the board, this is just consideration for adopting the report. However, we did receive some comments that we do want to discuss when we get to the mailing. So when we get to B1, we would like to go over a few suggested revisions with you. So for the purposes of the report, this is just, again, telling you what rules we sent to rulemaking hearing. So on June 26th, the July 22, 2025 rulemaking hearing public notice was sent out to 5,556 rulemaking adopted parties subscribers, and it went out to 18,763 licensees and registrants. People were invited to provide oral testimony during the hearing and encouraged to send in their email written comments. convened the hearing at 9:31 a.m. and we adjourned at 9:36 a.m. It's a very short hearing. 4 people joined the public call to listen to the hearing, and nobody signed up to provide oral testimony, and none was provided during the hearing. We received just 4 written comments on these rules, and the rules that were proposed were the Division 102, the board delegated authority, the new rule related to the vaccine protocol rules to adopt the ACIP recommendations. And then the other rules that were proposed were the new vaccination standard vaccination protocols, rather, and all of the protocols that you see listed here. So I will turn it back to you, President Joyce, for board discussion.
Are there any comments or questions or clarification needed on any of the rulemaking hearing report? Anyone looking around? No? All right, seeing and hearing none.
Oh, I'm sorry. Board Member Kirkbride has her hand up.
It's your.
That's okay. I must have shared. There we go.
Go ahead, Board Member Kirkbride.
Thank you. This is Board Member Kirkbride. Yeah, I mean, I would say it is what I expected, kind of a 50-50 response for people who support and people who don't. I think it is challenging when you're not behind the scenes and don't really know how the sausage is made to figure out, why might Oregon be pursuing this. But I would say I was not surprised by any of the feedback. I will say I was surprised and a little bit disappointed that there wasn't more, considering how much we've heard about this issue over the years, and how much pharmacists wanted change, that there wasn't more comment just in general, whether that was positive or negative. It seemed like very, very little feedback for such a issue that is perceived to be a big issue for particularly community-based pharmacists.
Thank you, Amy. Anyone else want to pitch in a comment? Rulemaking report. All right, so should I motion? Okay. Is there a motion to move to accept the July 22nd, 2025 rulemaking hearing report?
I move. Board Member Kroger. Second, Board Member Chin.
Board Member Joyce, yes. Vice President Kirkbride,
Yes.
Board Member Chin.
Yes.
Board Member Hall.
Yes.
Board Member Kroger.
Yes.
Board Member Patel.
Member Patel.
Board Member Pineda.
Board Member Pinedo, yes.
And Board Member Smith.
Board Member Smith, yes.
Motion passes. We will now review and consider permanent adoption of rules, starting with Staff Member Melvin and mailing B.
All right, give me just a moment. I'll pull this up. Board Member Kirkbride, did you have another question? Your hand's still up before I switch screens. I just wanted to ask you real quick. No?
No, sorry.
That's okay. Thanks. Okay, so this was one of the rules that was sent through. Again, this is a new rule, which allows the board to delegate limited authority for the vaccine protocol rules. And this is, just scroll down. Just spoke about this a minute ago, but this would permanently adopt OAR 855-102-0130. Again, allows the board to delegate to the board president the limited authority to amend the board's vaccine protocols to adopt recommendations issued by ACIP, adopted by the CDC, and that allows the board president to further delegate the authority to agency staff. The board interprets advising for purposes of ORS 689649 to not include amendments to the board's vaccine protocol rules in OAR 855-115-0345 that are required by the recommendations issued by ACIP, adopted by the CDC, because those amendments are required by law and the board's only course of action. And this is our rule language. It's just very standard. I don't think I need to read it, so I'll just turn it back to you, President Joyce, for board discussion.
All right, so I'm gonna go around. I'll start off with Board Vice President Kirkbride. Any comments regarding this?
Thank you. This is Board Vice President Kirkbride. Yes. So since we've been starting on this journey, I've been trying to gain information and stay on top of what might be happening nationally with other states. What are the vaccine experts saying? Like, what are people doing? How are people responding to the changes we've seen in ACIP? And, I would say that the waters are still a little bit muddy. We've had one ACIP meeting with the new group. I did attend that meeting in full, virtually, listening in to try to get a sense of, maybe direction or what this new group was going to be about. And I think, I had some concerns as we embarked on this endeavor, and I do still have those concerns. There's risk and benefit here. So my question is, if we enact this rule and we have this on the books, is there a scenario where we could hold on to this and not actually delegate that authority right away and give a little bit more time to see what direction ACIP is going to go? My concern being that I know we have some challenges now with keeping our protocols up to date, but we're really waiting on some big, heavy decisions in the October meeting, particularly when it comes to COVID vaccine. And if ACIP does something that is not in the best interest of our Oregon citizens, I don't want to see us in Oregon having our hands tied. So I'm curious, if we did adopt this, would we be able to just kind of have it there in our back pocket if and when we needed it? Because now might not be the right time to say we're going to follow ACIP. And that's all I have on this rule.
So what this rule does is delegate to the board president. So you would delegate it to the board president. And so you wouldn't, that's sort of like what the action of the rule is to delegate it to the board president. You could then delegate it to board staff. So that would happen by operation of the rule going into effect. Now, as we talked about before, you can pull this rule at any time, right? So you could, at the October meeting, if you wanted to enact it today, and then the October meeting you decide this is not what we want, you can initiate rulemaking to pull it. And I have to look at the temporary side of it, but there's a possibility it's sort of odd when you're pulling a rule, but you can technically do a temporary pulling as well, so it can happen immediately versus having to wait. So there's a little protection in that, but if you were to pass it today, what happens automatically just by the passing of this is that it's the executive director that has the authority, not the executive, the board chair has the authority to do the rulemaking on that limited topic. Did you hear all that, Kirkbride?
Yes, that answered my question. Thank you.
Thank you. Very well stated. Board Member Chin,
I have no further comments.
Board Member Hall,
Member Hall, I just have the same concern that Board Member Kirkbride mentioned. I don't know. I have some reservations about it, but good, bad. I don't know. I'm curious to see what others think.
Board Member Kroger.
Board Member Kroger, just want to say thank you to Vice President Kirkbride for due diligence and really staying on top of this kind of ever-changing situation with ACIP and the vaccine recommendations. I feel similarly concerned and, you know, at a loss for really what's the right path forward. However, I think right now, you know, we're in a place where we need to have something to go forward, especially with, you know, respiratory season right on the horizon and the pharmacies having the ability to immunize and to go forward under the current ACIP recommendations. I think that this just needs to maybe stay on top of mind as we go forward, if we need to adjust in some manner to make sure that the citizens of Oregon have access to the vaccines that they may need. So I guess we never really thought that we would be questioning ACIP recommendations or that process, but here we are. And I think right now this is what we need to go forward with, and having the more flexible or quicker process of having protocols updated, but then just being very mindful as we go forward on if we need to make quick changes. Thank you.
Board Member Patel?
I think, DOJ fund wants to say something. I want to hear.
Yeah.
Sorry, yes.
Angie had, I hate saying, your mom's gonna say age, and that sounds too like, I'll say my name, okay. I was like, Angie. So the one thing Rachel was pointing out too, is that one of the things you could do is change the effective date of the rule. But the one thing I'm just trying to think through on the spot here is if we didn't pass this today, how does that affect the protocols that we're putting forward as well? Because those all tie into the change, right? So I'm not sure if this didn't pass, what we would do about those. So that's something I just need to think through, and how that could affect those.
Board Member Kroger, I would be very concerned by not going forward with the current proposed rules and not having updated protocols available for the pharmacies. That would be a big concern of mine if we delayed implementation of this.
Ready. Member Patel, thank you.
It's the both side, because we have to pass it. And we don't know what will happen in October during the COVID season. Do have reservation too, but I think after hearing more comments, I think just pass it and we can, if needed, we can revisit in October.
Board Member Pineda?
Board Member Pinedo, I agree with Board Member Patel with it being so close to a big vaccine season. If there are enough concerns, we can revisit this in October.
And Board Member Smith?
Member Smith has no comments at this time.
Or President Joyce, yeah, these are uncertain times. In recent public comments made by ACIP and RFK Jr. himself, they are it definitely brings up some uncertainty about the future of vaccines and vaccine protocols. So at this time, I feel comfortable kind of putting this, giving us this window or putting this in our court to have some authority to do something to protect Oregonians and to make sure they have access to vaccines. What we can do exactly, it's not certain. But I think it's important that we move forward with this to protect our Oregonians, and that's where I'm at with this.
President Joyce, Board Member Kirkbride has her hand up.
Go ahead. President Kirkbride.
Yeah, I just wanted to comment on, what if we don't pass this today? We revert to what we have now, which is our current protocols. So it's not like we're going back to not having protocols. We have protocols for every vaccine. I would like to hear from Executive Director Runyon what the current status is of the Public Health and Pharmacy Formulary Committee vaccine SMEs, and what is that risk assessment right now that we would not get updated vaccine protocols in time for respiratory season?
Executive Director Runyon. So we have adequate staffing with the array of SMEs that we need to update the protocols. However, if we look at the cadence of the meetings and the onset of flu season, so if the recommendations are current or consistent with what has occurred in previous years, the majority of pharmacies will start, per CDC or ACIP recommendations, vaccinating for influenza September 1st. Unless there are other underlying conditions. So that would not give us time to update, for example, the influenza protocols prior to the onset of flu season when pharmacists are vaccinating. And that doesn't even speak to, as Board Member Kroger mentioned, the other implied vaccines, because this is respiratory season. So RSV, if there are any pertinent updates there, or COVID vaccines, and there may be several updates there. So it wouldn't give us time or the opportunity to submit that to the PFAC in order to bring it back to the board for adoption of any changes.
And rulemaking, board back to a special board meeting.
And rulemaking, of course.
Remember, Kirkbride, did you have any more to add?
No, thank you.
Or Kroger, did you?
Board Member Kroger, I believe it's my understanding that I think current CDC recommendations is to receive the flu vaccine by the end of October. And I haven't validated this, but I also believe Oregon may be the only state nationally not currently beginning their flu influenza vaccines. And I'm not a fan of being an outlier, especially in preventative healthcare.
Board President Joyce, any other comments at this time? This is an action necessary, action of rules. Is there any other comment, or we ready to motion on this? Okay. So, in light of that, is there a motion to move to adopt proposed rule OAR 855-102-0130 to be effective upon filing?
Member Chin makes the motion.
Seconded, Board Member Kroger.
Member Joyce, yes. Member Kirkbride, or Vice President Kirkbride,
Yes.
Board Member Chin,
Yes.
Board Member Hall,
Yes.
Board Member Kroger,
Yes.
Board Member Patel,
Yes.
Member Pinedo,
Yes.
Member Smith.
Board Member Smith, yes.
Motion passes unanimously. We'll now review and discuss mailings B1 related to the proposed vaccination protocols with staff member Melvin.
All right, give me just a moment. I will pull this up. Okay, staff member Melvin, this is mailing B1, but I have it in an edited version, what you're seeing right now. Remember earlier when we were discussing the rulemaking hearing report, one of the comments we received brought a couple of things to light that we would suggest a couple of revisions. So I am going to just scroll down to the first part of this, and I believe Executive Director Runyon can help walk us through this. Let me find the rule. In particular, it was right here. So in 855-115-0330, this is the services, the prescribing and formulary or protocol, the new version that we're suggesting. It was brought to our attention that in para 9 of the new 9, the words "if identified" were suggested to be added here, and staff discussed this, and do I need to make this a little larger? Can everyone see this okay? We agreed with that suggestion, so we wanted to get the board's feedback on adding those two minor corrections, if you will. I don't have the comment in front of me. Wait, say it again.
Non-substantive.
Yes, non-substantive, or what I called it a statutory minor correction, but yes, non-substantive changes. I'm sorry, I don't have the public comment right in front of me, but.
This is Board Member Kirkbride. I can start.
Thank you, go ahead.
Yeah, I think that, I mean, there's been so many iterations of these rules over the years. Those words were in there at one point. I think it probably got removed when we made the requirement to report to alert. So I am not aware of anyone who is reporting vaccines directly to a PCP. Everyone is required to use alert and uses alert to report vaccines. So I don't think this makes any difference in practice. And I don't have any issue with it going back in.
This is Board Member Chin as a primary care provider. I have never received in 23 years anything from a pharmacy that they gave vaccines. It's all in alert. And I am not opposed to the insubstantial changes.
And staff member Melvin, I have the comment if the board would like me to read the comment or if we need to talk about it further.
Go ahead.
Okay. It just says in subpart 9, we thank the board members for acknowledging the value of alert immunization registry, allowing the primary care provider to be notified of an administered vaccine through reporting to the registry eliminates redundant activities in the pharmacy. We appreciate the board members removing this administrative burden. From the perspective of a prescription being issued to a patient, we ask the board members to consider patients who are accessing healthcare at a pharmacy who don't have a primary healthcare provider. We suggest the following minor amendment to the language. And that was again adding the "if identified" to that part of the rule. Okay, back to you, President Joyce.
Mr. President Joyce, yeah, it's a non-substantive change. Any other comments at this time? Should we go and just scroll down? Is that the only?
There were some other suggestions on the actual protocol. So before we can look at the rest of this rule and then I can close it. And then I'd like to open the two other protocols that were also suggested amendments.
That's excellent. Board Member Patel, did you have a concern?
Yeah.
Yeah, Board Member Patel. Still, I'm confused. So why we want to make this change? That means we don't have to kind of fax primary care healthcare provider, right? Or
do we have?
So I think what happened back in the day, we've always had a statute that required the board to have a rule. So there's this, and I can find the statute like for you, but, there's a statute that says the board has to have a rule that requires pharmacists to report to the primary healthcare provider, and it, like the statute said, like, we have to have a rule on this. And then OHA did their thing where they did the alerts and everything happened. And so I think so I don't know if we ever had a rule on this, but we don't currently. And so this was just part of a cleanup of like making sure we were in compliance with the statute, adding this back in. So tried to write it in a way that it sort of complemented the existing alert process that everyone will probably still just continue to use, right? But still being in compliance with the statutory requirement that tells us we have to have a rule on this.
Oh, gotcha. So there's nothing, okay, makes sense, thank you.
It's more wordy than it used to be. So I think people are seeing this, that we are trying to change something or enact something, but we're really not doing anything with reporting to the provider. It's just it's more wordy than it was before. So it's more obvious, but nothing changes.
Okay, President Joyce, so we did not amend anything else in this particular rule set. I'd like to open the protocols, though, that we also had suggestions on, if you're ready.
Yeah, let's move on, I think.
Okay.
We're ready.
But we're not, because we still. This is she needs to call or I can try to ping her back in. Give me just a moment. Board Member Pinedo dropped off the call. I'm going to try to pull her back in.
I'm back in.
Okay, I see you on. Thank you. Give me just a moment so I can find the proper protocol. This is it. So let me share my screen. Another suggested amendment, which would be on the protocol 3 through 6 years of age for the assessment and treatment care pathway. That was also suggested by this same person who submitted comments. They and staff again looked at this as well, and I might need you on this one.
This one we've done.
Yes, so they were asking if we would strike end pregnancy status. So and these suggested changes that you're seeing in front of you now. Sorry, let me make this a little larger so you can see this. So we would add the word "and," so it would read, the screening questionnaire should include questions that require patient information, including current health status, present and past medical history, allergies, medications, and immunization history, and it would end there. And if you give me a moment, I will give you the comment for the reasoning for this.
I mean, do we need it?
Maybe you don't need it.
This one's pretty clear.
It is, it's very clear. And the other protocol, so this is B1C. They are asking for the same strike in mailing B1D, which is so they're asking for it through 3 through 6 years and the 6 months through 2 years of age. So they're identical. So if I don't need to open it, those were the only other suggestions that we had that, again, we are able to amend without sending back to rulemaking. So I'll send it back to you, President Joyce, for discussion.
And in this portion, I think this is obvious. Any comments needed for this particular section or? Yeah. All right, so let's move on. B1C, I believe, is next, or?
Oh, did the board need me to open any of the protocols? The only other one I just showed you is identical, so it would just be striking exactly the same language.
So, be ready to motion? Okay. Is there a motion to move to adopt proposed rules OAR 855-104-0055, OAR 855-115-0330, OAR 855-115-0335, OAR 855-115-0340, and OAR 855-115-0345 to be effective upon filing.
So move, Board Member Chin.
Board President Joyce, point of order. Sorry, I thought we were still discussing potential edits.
I'll pass that on to staff member Melvin to answer.
Oh, staff member Melvin, board member Kirkbride, we had no other suggested edits. The other mailing for B1C, I didn't open, it was exactly the same strike. So removing the pregnancy language from that was the only other amendment we had proposed.
There were some comments about the vaccine lists,
Revisit them maybe.
and the lists are not complete, so.
Oh, yes, thank you.
I'm sorry, I thought we were
That's
just,
okay.
I thought you were just gonna vote on the pregnancy thing, and then I heard the numbers, and I'm like, uh-oh. Wait a second.
Yeah, let's pause and reset, and then Executive Director Runyon will take over.
Board Member Chin withdraws the motion.
Okay. Go ahead.
Executive Director Runyon. So, Board Member Kirkbride, Vice President Kirkbride, what you're referring to wouldn't change any amendments that we have in the rules. So would you like to discuss that now or afterwards, since it wouldn't change the motion or anything that we have present in the rule?
If it's not present in the rule, we can discuss it later. The other comment that I had, and again, I don't know if this is in the rule, was there was a comment regarding training, and I think it was a good comment and something we might want to talk about is it still necessary in this day and age to require the documentation of training? I think that piece probably is in the rule.
There was, what I recall from the two comments, or from the comments of all that were in that document, anything else that was in that document that were comments on are stuff that needs to go to PFAC before
Okay.
the board can do anything about it. So
Okay.
we would definitely, I think that was the intent, was to take those things to PFAC to review at the next PFAC
Okay.
meeting.
Executive Director Runyon, that's correct. So the addition of the chikungunya vaccine, which was adopted for ACIP recommendations, occurred after, I believe, the April 2025 PFAC meeting. And I did bring that up, I believe, in public session at the June meeting, and that it was ACIP approved, but due to the timing, we were unable to add it to the list, and that would require PFAC input. Same thing with the recommendation to add the RSV vaccine, with the caveat that it would only be available to pregnant patients from the ages of 7 through 17. So that would have to be added to that general protocol under the PFAC's direction to bring back to the board as well. So it wouldn't result in any rule changes that we're seeing now. And then AG Hunt, if you want to add anything, you're welcome to. But in terms of the recommendation to further amend the requirements to document and record training, from what I understand now, there's a mixed bag in terms of whether or not pharmacy schools or colleges are using the APHA administered programs to provide that immunization training, or whether they're including it in the curriculum itself, in which case they may not have a certificate. The last study I saw was several years ago, it was 2019, and it said that 93% of schools at that point were using the APHA still to administer that training, where they would get a certificate, and then the other 7% were either including it in the curriculum or they were using some other agency. So I can't provide numbers as to what that is now, but the way things are evolving, I think at some point we might need to consider amending that to reflect either the schools include it in the curriculum and they wouldn't get a certificate, therefore they're continuing to use APHA and they would. So how can we address that until it's either one or the other, and still maintain what we need to do to protect public health, safety, and welfare, and ensuring until we move to, or if we do, a standard of care regulatory model, which was mentioned in that and public comment, where it would be incumbent upon the pharmacists to ensure that they have adequate education, training, and experience to provide those services. How can we ensure that that's being done from the regulatory standpoint until the practice progresses to a point where we don't need that anymore?
And Staff Member Melvin, just to add to that, the suggestions, we thank you for sending these comments in, but that would be substantive too, and that would require rulemaking again, which is why we weren't suggesting edits. Does that help, Board Member Kirkbride?
Yes. Executive Director Runyon, can you talk a little bit more? I guess I'm surprised to hear that we have to go to PFAC to add a vaccine to the list. I thought we were going to be able to edit this list like today before we enact the rule to kind of start with what it is today. What does that flow look like? So if the board president has authority to adopt ACIP, I'm just trying to puzzle together why we have to go to PFAC to add a vaccine to the list.
The only thing that authority does is allow the person to update the versions of the existing vaccines. So if you want to add a vaccine, that has to go through PFAC, and that's just the statutory requirement that we have. That before, where everything had to go back to PFAC, right? Like, so before we had, or still currently, it's not filed yet.
Correct.
Right, anything would have to go back to PFAC. But what we're trying to do, right, is so that when the versions update and things change that are specific to the individual vaccines that are already existing, that have already been adopted through the process of PFAC and the board, those can be updated as the versions change that come out through the CDC, but anything else like happens that has to go through PFAC.
So are they working on a protocol for RSV and chikungunya?
So they wouldn't necessarily work on a protocol for it. They would just approve the adding of them to the list. So they have to approve adding them to the list, and then it would come back to you guys to add.
So Board Member Kirkbride, this is Staff Member Melvin. So the PFAC will meet towards the end of October, and these items will be presented to them like AAG Hunt stated, but it's streamlining that process. So SMEs don't have to join the meeting and present a drawn out protocol. It's just adding the name, which would allow us to amend that in rule.
So
then going forward, if there's updates to the RSV vaccine or whatever it is, or the
chikungunya.
then you would just, once the delegation process happens, then board staff can just update those in sort of real time, right? As any sort of changes to those vaccines happen. But the intent of this was not to, the legislative intent behind everything having to go through PFAC is the only thing that we are changing is things that we can change that don't have to go back to PFAC. And that is very much just like basically saying like, every time a new update is made to a vaccine, we don't have to take that process back through PFAC. But we can't add a vaccine to the list.
So realistically, we're looking at December, is that what I'm hearing, for new vaccines to have protocols?
Executive Director Runyon, that's correct, based on I believe, October 23rd PFAC meeting and subsequent December board meeting after that.
Yeah, so Staff Member Melvin, so we would most likely be bringing a temporary rule potentially because there isn't an additional rulemaking hearing scheduled.
Okay, that was all the questions I had on vaccine protocols.
Board President Joyce, so are we ready to motion or is there any additional comments? Board Member Kroger.
Board Member Kroger, around the training requirement that Board Member Kirkbride brought up and the comment related to that. I wanted to dig into that just for a bit and ask a question. So this is in 855-115-0330, Para 6. This is for each drug or device the pharmacist prescribes via formulary. Vaccines are a protocol. Is there a difference in the requirements there? Because I understand like the administrative regulatory burden or this is a standard of, I mean, this is the standard for decades now that pharmacists are trained in school and or had been, you know, if they didn't get it in school, like they did get it in school, but so I'm wondering, is there a slight difference in that? Because I think what I'm imagining is, you know, perhaps upon inspection, the pharmacists are being asked to provide proof that they have the training and education to provide vaccines, which as Executive Runyon, there 7% of pharmacists might not necessarily have a certificate in hand to prove that, and that's going to cause stress and concern as well as administrative burden in those situations. Am I understand, is that for the formulary, right? We're talking about the drugs and devices, like there should be maybe a bit more training if they're prescribing birth control or pep and prep, perhaps, and standard of care regulatory model, a bigger, longer term picture looking at that. But I'm just wondering specifically for the vaccines administered, prescribed and administered by pharmacists, is there a difference there?
The way that 689-6491 is written, it specifically says that the board has to convene the PFAC for the purpose of advising the board and promulgating rules under 689-645. So it basically means if you're doing any rules under 689-645, it has to go through PFAC.
I'm talking about the training requirements.
Yeah, so that's like, so that's why the training requirements would have to go through PFAC because it relates to it has to go back through PFAC first before we can do anything.
But in the current proposed rule, the addition under current 6 says prescribes via formulary. But vaccines are not on the formulary, they're under a protocol.
Okay,
Sorry.
no, then I don't know.
I'm just wondering if that kind of resolves the concern that we saw in the comment and that board member Kirkbride brought up.
Victoria, I think it also possibly says something in the vaccine rules as well about training. It's in multiple places.
I think it's also right here, 104.
Did anyone else have a comment before we motion on this?
This is board member Chen. I would just encourage the PFAC to figure out how not to have to pull up your training history from prior years ago. As we move to the knowledge, skills, and abilities type of practice that most medical professions have. Please, before I
I think for maybe the purposes of today's discussion, I think this is I think an overarching concern around for pharmacists specifically, the training and education retention requirements. It's starting to feel a bit outdated with how training is even completed and ACPE requirements for pharmacists coming out of pharmacy school. You know, like I think back to like what I have, graduating many years ago, even with my APHA immunization certification for, right, like, and I think APHA, they don't retain their records either after a certain period of time. So if I took it more than 10 years ago, I wouldn't even be able to get that certificate if I needed it at this moment, if I didn't already have it in hand. So I think maybe for the purposes of today, it might not make sense to have that discussion, but I think we need to revisit it going forward because this is an administrative burden. If B, I don't know if I would be able to, if I was immunizing patients, I don't know if I personally would be able to satisfy B. I took APHA. Immunization training, I do CE continually. But that initial training is probably onto the first.
Board Member Patel.
Member Patel, and I think I also made so many times comments on this training records of immunization administration and protocol and retaining the training record and everything. And I think the previous board members, the few previous board members, they also raised the concern that is it necessary to keep the records for the training? Because Member Kroger is right. They only, I think, keep for certain time and they don't retain the record. That means that pharmacist has to take another training, which is unnecessary. And those training are not cheap. I do remember I'd done that training like maybe 5 or 6 years ago. And it was like $400 because I couldn't get my APHA immunization certificate. So it's like, it's unnecessary financial burden and it's just absolutely unnecessary. And I think Alabama State was the last one to kind of pharmacists start giving immunization, but most of the state, like I would say, we are doing this for decades and decades. So I don't think so we need B. I already tell my comments so many times and I'm just repeating again.
Board Member Kirkbride, it sounds though like if we want to make that change, we have to send this back to rulemaking. So again, in the interest of we need people to be able to immunize for flu season, it sounds like we can't effectively have that discussion today. So I think it's a good discussion, but it sounds like it's another task.
Or Jen.
Board Member Chin, didn't I understand that PFAC has to make that? Has a role in making that go away? And if PFAC has a role in that, can you all? I don't think there's anybody on the board who is not in support of B going away.
Staff Member Ekema, I think part of what was raised, we had a short amount of time to look into thoroughly enough and didn't have time to look in with council. So I think there's a lot of great points that's been raised that we need to go through the machinery like we always do, pull it all together, bring it back to the board so you can have an informed discussion of all the potentials, risks, consequences, and or is this something that has to go through PFAC or not, depending on the lens that it's looked through. So I think we need to do more sufficient research to make sure we keep you on the high ground and what is legal and right.
And I think that you all have the direction of everybody in the room for what we're aiming for, then I think that's great.
Thank you.
Board Member Kroger, I don't know if this is something we can discuss now or later, but enforcement discretion on particular aspects, especially I think upon inspection is where I think, at least right now in the interim, where the most angst may come from licensees regarding, you know, your old pharmacist like myself, perhaps. So, but yeah, I think for the sake of moving forward, you know, we don't need to hold up this conversation any further, but I think, like you said, hopefully everybody's in agreement.
This is Board Member Kirkbride. Just one final comment, please. When you do that review, Staff Member Efremoff, review chapter Division 115 0305 rules as well to look for those other references to vaccine training.
Board President Joyce. So question for Board Member Smith. You know, being a new member, do you have any questions or clarification needed you can ask regarding this process?
Board Member Smith, I think I understand it pretty well. I think for the time being, the most pressing need is to give the public the ability to get vaccinations in Oregon. This is a minor point. I think it definitely does need to be looked at. It is like I have my copy of my training framed for this reason. So it is something though that it's like every pharmacist I know is basically trained on immunizations now. I have it like, because I know some pharmacists I's dotted, T's crossed. But I think for the time being, it's important to pass this, so we can address the immediate need of immunizations for the upcoming flu season. But this is something that we should probably circle back and check into, make it simplified and easier to understand. So,
Very good.
thank you.
Thank you. Board Member Hall, did you anything additional or clarification needed?
No.
And Board Member Pineda? You need to,
No, none at this time.
this time, okay. All righty, so are we ready to motion? Okay. Is there a motion to move to adopt proposed rules OAR 855-104-0055, OAR 855-115-0330, OAR 855-115-0335, OAR 855-115-0340, and OAR 855-115-0345 to be effective upon filing.
So moved, Board Member Chin.
Yeah, Board Member Hall.
Board Member Joyce, yes. Board Vice President Kirkbride.
Yes.
Board Member Chin.
Yes.
Board Member Hall. Board Member Kroger.
Yes.
Board Member Patel.
Yes.
Board Member Pineda.
Yes.
Member Smith. Yes. Motion passes unanimously. Back to Staff Member Melvin for review of mailing B2.
All right, Staff Member Melvin, I promise this one's very simple. No comments were received on this one. Always start with that. Again, this is B2. This was one of our kind of tail end standards adopted by reference that were missed on that first round, if you recall. So this would just permanently adopt those incorporated standards adopted by reference, and that is in OAR 855-115-0130. And also 855-135-0001, where it's just, again, updating those versions of ACPE and ACCME in one sub A and B. And back to you, President Joyce.
Board President Kirkbride, do you have any questions on this section?
No, I do not.
Excellent. Anyone else? Hands up, please now. Okay, Board Member Kroger.
Board Member Kroger, I don't have anything to say about this, but I just wanted to take a moment since we had the time to extend a sincere gratitude to board staff, AG Hunt, Gary Runyon, PFAC, Bree, everybody who has really done a ton of work on those vaccine protocols to, I think, really do what's right by the people of Oregon. And I hope you guys feel really proud about the work that you've just completed. So thank you very much.
Definitely second that. Thank you. Alrighty, so is there a motion to move to adopt proposed rules OAR 855-115-0130 and OAR 855-135-0001 to be effective upon filing?
So moved, Board Member Chin.
Member Smith, seconds.
Member Joyce, yes. Board Vice President Kirkbride.
Yes.
Board Member Chin.
Yes.
Board Member Hall.
Yes.
Board Member Kroger.
Yes.
Board Member Patel. Board Member Pineda.
Yes.
And Board Member Smith.
Yes.
Motion passes unanimously. We will now hear from the Executive Director Runyon regarding a recap of the 2025 legislative session mailing C.
Executive Director Runyon. So looking at mailing C, the end of legislative session report. Just on the front end, I'll tell you there's a lot of duplicative information here as compared to the report that we gave in the June 2025 board meeting, and that will occur later in the strategic plan update. So here we'll just take a few brief moments to focus on the most pertinent bills that either have fiscal impact for us or where it's been directed that the Board of Pharmacy needs to promulgate rules. So we'll just go down and we'll start with HB 2385. think at this moment, we'll just acknowledge everything that's printed there and we'll skip further discussing that. I think we all know what's going on with that at this point in time. And then 2387, there isn't anything here that requires to promulgate rules. However, I believe it's something that should be on the forefront of our awareness in the event that we might eventually see some complaints or information based on this. So this allows licensees of certain health professional regulatory boards to provide psilocybin services as licensed psilocybin service facilitators while providing healthcare, behavioral healthcare services, and the provider is authorized to provide. And I believe there's a provision in here that as long as the provider is licensed in providing services within the scope outlined by law, that these health regulatory boards wouldn't be able to pursue any disciplinary action subsequent to those services that are being provided in accordance with the law. And next, we'll talk about House Bill 3045. And again, we covered this at the June business meeting. And just to let you know some updates here. And we have a master agreement in place, and it's been renewed, I believe, at the beginning of July with HPSP. And we're continuing to work with partner agencies to assess and unify best practices and monitoring and administrative requirements, et cetera. And I think the majority of these, I think section 2 and 3 of this go into effect January 1st, 2026.
This bill that was passed that allows us to do the mental status exams beyond the sending them to the.
For Kroger, do we have to do rulemaking on that at all?
I haven't looked at it, so no, but.
And this-
It's executive director running now. I think we'll need some slight amendments to the rules, which I'll briefly talk about the rules in development mailing in a little bit, but yeah, we have sufficient time to schedule that before it goes into effect January 1st of next year.
All right, let's see.
And next we'll get House Bill 3912. So again, this isn't anything that has a fiscal impact on us or that would require us to promulgate rules. However, we believe that it is necessary to include this information in some sort of communication, whether it be a gov delivery blast or whether it involves an ABP newsletter. So this bill requires an individual use the title doctor, which of course in certain instances pharmacists do, in connection with the healthcare profession to designate on specified material such as social media posts, name badges, etc., and the healthcare profession in which the individual earned a doctoral degree. And just realizing that there are a lot of pharmacists out there that press for time and may not have the luxury of tuning in for these meetings or keeping up with all of the legislation that's passed. It's necessary, I feel, for them to know that. So I think we have an opportunity to disseminate that information, which would be in their best interest. So staff will take care of that.
Board Member Kirkbride has her hand up.
Board Member Kirkbride, you have your hand up.
Yeah, I just had a quick question on that. I know we do have rules about name badges. Did you say you did not expect this would change anything with rulemaking for us?
Might defer to AG Hunt on that.
I have to look at the name badge rules. I don't know, not bad, but I can look at it.
I mean, I'll just comment that it is already kind of it feels very oppressive that someone's telling you like what to put on your name badge already. And so if we're going to be amending those rules again, it just seems kind of silly.
I did not get rules for that.
Executive Director Runyon, and I think the respective rules that we have in divisions 115, 120, and 125 don't necessarily explicitly outline what's required on the name badge, other than that individuals must be appropriately identified in all interactions with the public. So I think that would require further evaluation, but at this point, I wouldn't look for there to be any need to explicitly add that into any rule amendments.
Okay, thank you.
Yeah, next we'll briefly touch on House Bill 5028, which you all are very familiar with. And I'd just like to extend a special thanks to everyone for making adjustments in their schedule to make the special board meeting, which was instrumental for us to make the necessary adjustments to expeditiously implement the changes that were signed into law by the governor and state legislature. And we'll cover a little bit of that on the rules and development report and strategic plan update as well.
Very good.
All right, next we'll look at Senate Bill 236. And you could look at this as formerly House Bill 3046. So this is one of the biggest successes, I think, of this legislative session, not only for us, but other state associations and really all of the Oregonians that I believe will be helped by the rules that we can now promulgate allowed by the passage of this and signage into law. So it's an omnibus bill, and amongst the more pertinent language for us, it includes pharmacists as mid-level practitioners for the purpose of prescribing controlled substances in class 3 through 5 that are approved for use in opioid use disorder, which will facilitate pharmacist registration with the DA to obtain authorization to prescribe these controlled substances using their unique DA number. So this would allow pharmacists to prescribe medications for opioid use disorder, MOUDs, via statewide protocol developed by PFAC in consultation with a physician who has a background in addiction medicine. And that language is directly lifted from the bill, or they can also prescribe it via CDTM. So a few things I want to say about this bill. Thanks to OSPA, did a lot of work with them to create language that was acceptable to both parties once we had to switch to using this vehicle as opposed to House Bill 3046. And I'd also like to thank the board. I think looking back, this occurred, a lot of these pivotal conversations that allowed for this to get passed occurred just pretty soon after I was appointed. And so I think one of the reasons that this passed is not because I did anything special, it's because I came from an internal perspective and I had so much knowledge about the PFAC process and the protocol development process, because there was significant concern on behalf of certain legislators as to what extent this might expand the pharmacist's scope of practice and to what extent that was appropriate, especially as it may have related to, in their opinions, taking patients out of the holistic continuum of care if they were solely getting these MOUDs from the pharmacy. So I think it was the April PFAC meeting that day that I was down there at the state legislature and provided some comments related to the epinephrine protocol that we reviewed that day. And that conversation in and of itself was a pivotal or turning point where the lights came on and they said, okay, since you've proposed this, it's present in another protocol, we feel more comfortable with it. So I'm not sure that would have happened if anyone else without that intimate experience of those processes and protocol generation, were in that position. So thank you for allowing me to represent you and the Oregonians in those situations. And I think because of that, literally there will be lives that are saved, especially in rural areas where healthcare access is diminishing. So I think you could give yourselves a pat on the back there. Is you affect Oregonians not only in the decisions that you make in these board meetings, but also who you appoint and who you allow to represent you. So just thank you to the board for that. Again, thank you to SPA. And then I'm working directly with clinical pharmacist from OHU's impact team, Emily Skogrand. I'm probably butchering that pronunciation, but working with her, we've actually been able to recruit several SMEs to work on this protocol, including a few MDs, which again is required in the language of the bill. We've also amassed considerable amount of resources. We've already had a couple of meetings with them, and we have some meetings scheduled with outside agencies, including Nevada Board of Pharmacy, including some VA clinic sites that are already doing this. And by doing this, I mean allowing pharmacists and facilitating pharmacists to prescribe and take care of patients with the MOVDs. So it is already in process, and I think the goal is to have some sort of submission ready for the next PFAC meeting, which would be October 23rd. And unless you see anything else that catches your eye, I believe that's it for this report.
There may be some things that we. Okay, that's it.
President Joyce, back to you.
Joyce, thank you, Gary. Thank you for your hard work. Now, moving on to, first of all, were there any other comments or questions on the executive session? No? Or no? So back to you, Executive Director Runyon, for a discussion. Oh, I'm sorry, I didn't see you. I need to look up. Remember Patel?
Yeah, remember Patel. To Executive Director Runyon, is that the same bill also talk about the prescription locker, or is it, didn't they combine all together with the big beautiful?
Don't say those words.
I think 236.
Executive Director Runyon, yes, that's correct. And that's it's a perfect segue into this next mailing because it talks about Senate Bill 236 as it pertains to amendments in prescription locker rules. So.
Thank you.
Alrighty, so looking around, no other comments, hands up in virtual world there, okay. Alrighty, so back to Executive Director Runyon for a discussion about a proposed letter for the DEA regarding controlled substances and pharmacy prescription lockers, mailing D.
Executive Director Runyon with mailing D. Hope you all had a chance to read this. It's very similar to the letter that we sent, I believe, in 2023 or 2022. So basically, you all know that in April 2022, we adopted rules for pharmacy prescription lockers. At that time, the DE regulations did not address or did not allow storage of controlled substances in those lockers. And 2025 Senate Bill 236 kind of required or amended our ability to register those in stating that as long as the outlet was operating in the locker, essentially it didn't have to register it with the State Board of Pharmacy, is at the same physical address. So pursuant to Section 19 of that bill, it's considered part of the retail drug outlet and therefore a separate license or registration is not needed. And also notably, 236 is silent on the storage of controlled substance prescriptions in PPLs. So essentially, this letter is to the DEA to have them reconsider and entertaining explicitly addressing this in their rules, because we want retail outlets or any outlets operating these to be set up for success and to understand not only what is required of them, but also what options are available to them. And we want there to be unification between our rules and the DEA communication. So this is just a letter requesting that they further consider this, as we think as this emerging technology continues to be implemented on a broader scale, that this issue will come up with a greater and greater frequency as time goes on. I'm happy to answer any questions here. Should be self-explanatory for the most part.
Board Member Joyce, Board Member Patel, did you have a comment on this particular section?
Board Member Patel, since you asked. So we are waiting to hear back from the DEA, right? They can allow to put the controlled substances into the prescription locker.
Executive Director Runyon. So we're going to mail this.
Okay.
We haven't done so yet. So essentially, this is just a proposition to the board to ensure that there aren't any further amendments that you'd like to make to this letter before we send it out.
Letter itself is good, but then and we have to make the rule on this eventually. The prescription locker, because whatever current prescription locker rule we have that do not align with that SB 236.
Executive Director Runyon. So yes, there is further rulemaking that would be required for our rules as a byproduct of SB 236. And then also depending on what the DA decides to do, if they decide to do anything that could lend itself to future rulemaking. And I think it's Division 143.
Yeah.
Angie. Council. Just so you're just talking. I think maybe what you're wondering about is the fact that the rules still talk about that you need to register. And the law changed it away from register. So yeah, so just for right now, effectively, they wouldn't accept an application, they wouldn't process an application, wouldn't make anybody get registered or renew a registration because it's no longer permitted, right? So we'll change those rules, but they wouldn't, and we need to fix the rules, but we wouldn't in application, like if Christy was to get an application, she would be like, don't do this.
I know, because everyone is waiting for this one because there are so many, especially in the rural community, all the pharmacies, they're like now, as you know, all the pharmacies closing and now they're trying to do how this patient they can access, and everyone is looking for this prescription locker rule. They're not even dare to even apply because of our current rule and regulation and everything. But as soon as we resolve this, as soon as we heard back from the DEA, and as soon as we work on our current prescription locker rule, I think it's imperative right now that we definitely have to work on this prescription locker rule. So pharmacists, the in-state pharmacy, they can apply and they can have prescription locker in the really, really remote area of the Oregon, where people, and I'm not kidding you, they have to drive at least about an hour, hour and a half to get the prescriptions. And usually those pharmacies, they open 9 to 5. So basically you probably have to take day off to get just your maintenance medication. And to me, it's like concerning to me. Thank you.
Executive Director Runyon. I think, as I understand it, speaking with licensing director Hennigan, we've actually removed the PPL application from our website. So if an individual has one that they would like to incorporate into their practice, they currently couldn't register it. Am I understand that correctly?
Member Hennigan, that's correct.
Because they don't need to be registered.
But the rules are still in effect.
And Executive Director Runyon, and furthermore, which I would open this up to AG Hunt after the comment, in order for the rules to apply that we have in Division 143, the PPL would have to be, they would have to have a PPL. And technically, in order for it to be a PPL, it has to be registered with the board. So if they're not registered with the board, it wouldn't be considered a PPL per our rules. Therefore, those rules would not apply. And I don't know if we want to.
Well, even if you had a claim on board, my advice would be not to enforce it, right? Because it is in violation of the statute. So we wouldn't do like. Because the statute has changed, right? Now you don't have to register. So that requirement has been removed. So you can't enforce.
That is good to know, and thank you for this really good discussion and the comments and everything. Whenever you guys have a time, I know you guys have, you guys are busy, but I think it'll be good to write down something in the newsletters that, hey, guys, because I think most of the still comments are there under the impression that, hey, you have to apply, you have to follow all the rules and everything. So I think, but this discussion is good, so I can refer to that, like you've heard in our comments. Thank you.
Excellent. Board Member Kroger.
Yeah, Board Member Kroger, I think for those licensees not listening to today's meeting, it would probably be a really good idea to communicate to the licensees the impact of this House bill and the process that the board will be going through. Like, if I was trying to have a PPL and I'm like, okay, right now the rules say I have to register. I don't see registration on the website. And they weren't listening to this conversation, they're gonna think it's right, and you might be even feeling more questions. So I think a newsletter or just I don't know, whatever email blast you guys send out would be wise to do, and appreciate it. Thank you.
I just want to say, good job. Thank you so much. I know Executive Director, and you worked really hard on SB 236, so thank you. Yeah, you did. Yeah, I know, you're being trying to be honest now. Yeah, I know. I'm just kidding.
Board Member Smith, are you up to date on the PPLs and what's going on here? Being a new member.
Member Smith, yeah, I think I have a pretty good understanding of what we're doing here. Yeah.
All right, Board Member Hall.
Additional comments?
Board Member, Pinedo.
I think it's great. No comments.
Board Vice President Kirkbride
No additional comments.
and Board Member Chin.
No additional comments.
All right. So we have a consensus on the letter, the Dear DEA letter. So we will now have an update from Executive Runyon regarding rules and development. Break. Actually, let's go ahead and take a break now. And then we'll come back. That clock up there on the wall is slow. Let's come back at 10, is 10:15 okay? 15 minutes, oh yeah. Okay. 10:15 it is.
10:15, okay.